My name is LaCasce. I'm a lymphoma physician. I treat non-Hodgkin lymphoma, Hodgkin lymphoma, and chronic lymphocytic leukemia. I also do autologous stem cell transplant in lymphoma and CAR T-cell therapy in lymphoma. I love working in oncology because of the longitudinal relationships that you develop with patients. We meet people in a very vulnerable time when they have a new cancer diagnosis, in my case, a lymphoma diagnosis. You really get to know people really well, and the therapies for lymphoma have changed so dramatically since I've been doing this more than 25 years. It's really quite amazing to be able to convey that to patients and get to know them and their families over time. So why should patients come to Dana-Farber? I think there's a lot of reasons. I think we're uniquely positioned in terms of the research that we do that really leads the field forward and develops novel treatments and understanding of the biology of various cancers. So that's one aspect, and then we like to apply that to how we treat patients. There's really a commitment to patient care here, and everyone recognizes how stressful it is and life-altering to be at the cancer center. And people are kind, and I think we take great care of patients in a very compassionate way. People really feel that when they're here. So what's unique about the Dana-Farber lymphoma program is that we have breadth and depth. So we treat patients with all different types of lymphoma, B-cell, T-cell, Hodgkin, CLL, cutaneous lymphomas. There are a lot of different subtypes of lymphoma. So working as a group with lots of expertise in these narrow areas, I think really allows us to offer something that's unique. So I think that first visit there's a lot to cover in that first visit. You want to first get to know the patient, understand how they're feeling. There are many different types of lymphoma. They have very different approach and prognosis. So I think it's important to educate patients about what the disease is. And then we have to talk about what they can expect and sort of what the treatment options are, obviously. And then I think it's really important to talk to patients in that first meeting about psychosocial support. So, what are the things that we can do to support them that are not necessarily prescribing chemotherapy or immunotherapy? It's really about trying to personalize it to the individual patient and figure out what their needs are.